Introduction of INNO Implant Fixture Design. Platform switching connection. Outline form. Thread shape. Non-microthread design. The connection of INNO submerged implant is hexagonal Morse taper connection. The implant has the 4 spider cutting edge, the double buttress threads, and the Crestal straight and apical tapered outline. There is not the microthreads and Crestal portion. INNO Implant System's abutment fixture connection design is platform switching, that the diameter of fixture is wider than the diameter of abutment in connection portion. Platform switching design is reported to migrate the functional stress from marginal bone to cancellous bone. As a result, the marginal bone could be maintained without bone loss. The mean age of the patient was 58.5 years with a range from 25 to 73 years. The average loading time was 13.4 months and the shortest time period was 10 months with 8 patients. A total 144 dental implants were evaluated in 47 patients. 54 implants in 21 females and 90 implants in 25 males. Total marginal bone loss was 0.027 plus minus 0.0138 mm. In the review of Ite et al., the average marginal bone loss around platform switch implants of 1 year follow-up was 0.021 to 0.99 mm. The marginal bone change of INNO system was not significantly different with Ite review. INNO Implant System's outline form is composed of the Crestal straight portion for the main stress bearing, and the apical tapered portion for the anchoring in the socket, and bone and the round apical end for prevention of tearing Schneidering membrane in sinus. In extraction socket, INNO implant could be anchored up to 25 Nm torque force in minimal 3 mm depth of bone. In extraction socket of mandibular posterior tooth, INNO implant could be immediately placed with the simultaneous bone graft, which shortened the loading period. In infra-sinus shallow ridge, INNO system could be anchored up to 25 Nm torque force in minimal 3 mm depth of bone. In infra-sinus shallow ridge, INNO system could be immediately placed with sinus bone graft. According to thread shape, the stress distribution patterns are different in implant and the surrounding bone. The ideal thread design distributes well-functional force and prevents the focal concentration of stress in the thread and bone. The commercially implant thread shapes are V-thread, reverse buttress, Power Acme, and INNO Implant System buttress thread. INNO Implant System's buttress thread is reported to show lower stress concentration in the thread and bone than other thread design. Submerged internal connection implant is classified to microthread and non-microthread design according to the Crestal thread shape. The advantage of microthread design is thicker wire in the connection portion than non-microthreads. The disadvantage of microthread design is lower stability in shallow sinus site than non-microthreads. In finite element analysis, there are not different maximal stress distribution in both of the cortical bone and cancellous bone and vertical and horizontal force, except to the oblique force in the cortical bone